you said, I didn't know what questions to ask. And that was part of the reason why I had went with this other software provider. What would you say to a dentist that's looking to buy, that's a new dentist, it's their first business, and they don't know what questions to ask?
First of all, what kind of practice are we looking at? Like what kind of practice vision that dentist has, that definitely determines what kind of software he's looking for. I was looking for a patient, more giving the value to the patient and making my job easier. I was looking at those two parters. And I think what I started looking at better was what is going to be my patient's appointment looking like. Starting from that first phone call to ending to getting paid by the insurance if I'm taking the insurance. And those steps, when I followed through, hey, if the patient is calling, what phone number are they calling on? Where are they calling at? How are we tracking that? Is my company going to be writing it down, making sure we are not losing any tracks, or are we going to be adding a third party that's going to be keeping a track for me? So adding third parties was already a very stressful thing. I don't think so there's any software, I could be wrong, that when I looked at all the softwares that said, yeah, you will need third party for this, or you would need third party for that. They had one or the other thing to add a third party to it. And like I said, CareStack was like, you have to have third party for the extra software. I was like, did not know, and I did not want that to be part of my deal at that time. So I was like, okay, I need to think about it. What exactly is the deal? And that's what got me thinking. So I think the right questions are what my patients are going to be calling at. If my team picks it up, how are they going to be putting the information in? If that information is going to go in, how we're going to make sure that patient gets messages for those appointments. Now I know more, so I can talk about it, right? How my patient gets messages, patient knows that they're going to come, how I'm talking about, because there was a time where I was talking to you about, I remember be like, is there a patient portal? And you guys were like, we have seen by studies that patient portals do not work because nobody wants to remember their passwords and anything, especially for dentistry, because we are not loading out lab results or anything where they're going to be on the patient portal. So I talked to you and I was like, okay, makes sense. But I was not so sure because I was like so bent on patient portal. And I came to know that we do have kind of a patient portal, but it is basically not password protected. It's not something that their particular documents are going to be on there, because it's so easy to send them the documents, but they can still book appointments online. They can still request those appointments and see my availabilities. And that's what I think I was looking forward to. And I have never missed patient portal again. Don't want it. I think it's good. Whatever my website designer was able to work with it too. So it was perfect. And it was so starting from there, going to next, that patient has come in. How are we going to make sure that all our patient ERX, all their treatment plan, everything is streamlined? And the way Tap32 does it, I don't think so I can go back to any other software. Anybody brings up Dentrix and EagleSoft in front of me, and I look at them and be like, I do not want to look at that thing anymore. So it's more of like getting used to. I'm used to my Apple phone. I cannot go back to Android. That's what it is. So people want to use their Android. I'm okay with it. So that was the few questions. Then sending claims. Oh my God, that thing is a saver. Like, I knew squat about front desk. Person I hired knew squat about front desk. And I was like, okay, I have to understand, I have to learn, I have to be part of this. And Tap32 came in and helped me understand the front desk like as if I was always a pro at it. Now I can talk about it, now I can use it. And I have been doing insurance claims myself sometimes when my friend was not doing it. There was a time there was team change. And I was so confident at what Tap32 did that I have sometimes be like, okay, it's just simple, it's intuitive, you don't have to think about it. And I did everything, and I learned everything from front to back in a jiffy. If I had to do that for open dental or anything else, I still see many times doctors asking the same questions in those same groups about Dentrix, open dental. Hey, how do we do it? And I'm like, thank goodness I'm not there. It's so easy and so simple. So I think these are the few questions that they need to ask, how simple and easy they want it for themselves. And Tap32 basically makes it. And your customer service, I think you guys did not charge me for it, but it's basically, I utilize your customer service every other day for the first 3 months. I remember 3 months to 6 months. Now I also know my team still calls you once a week to figure out something because they are stuck on their own things that they have not put in right. And 99% it is that the team had not put something in right, and your team comes through and helps us out. Like, I have team members sitting at Tab 32. Like, I personally started knowing people there. Like, I was like, can I talk to him? And they're like, oh yeah, he's out today. So I think that was another thing, having that kind of customer service, because people were like, go for an open dental. I was like, how do you learn about it? They have amazing YouTube videos. Guess what? Now you're messed up somewhere. Are you going to look up those YouTube videos, find the spot and do it? You have this amazing also help store, help where we go and search for it. If they are not able to get to you directly, they just go search and they find it. We don't need it anymore because we've gotten so used to it now. But we were doing that initially to learn, of course. And as I remember when we were talking to you initially, it was more like, hey, it's not the learning, it's more unlearning the worst system that we have learned through. So yeah, I think that's the questions every doctor needs to ask and go through with it, that how simple they want it.
Yeah. I think the third-party vendor fact that you just brought up, you said, the software company didn't tell me that they needed a third-party vendor. And, Tab 32 was first to market with a complete solution. But I can say that as much as I want. And until you experience it, you don't understand how important it is to have vision for what you want the care continuum to look like. And that's really, I think, the big differentiator between Tab 32 and a lot of these other platforms is we broke down the care continuum as it was being served in the 90s. And because it's still the same software a lot of people are using. And we reimagined the entire thing, not just to meet today's needs, but the future needs.